In the journey of life, we often face trials and tribulations that test our faith and resilience. But through every challenge, there is a guiding light. Revival of Hope Global Outreach Ministries proudly presents My Mess Became My Message, 7 p.m. by Dr. Michelle Pert Ford. Dr. Michelle has transformed her life's challenges into a powerful message of hope and healing. Her mission is to create a safe space for women to find freedom, healing, and self-worth. Join Dr. Michelle on this transformative journey. Discover the power of faith, hope, and healing. Together, we can overcome any obstacle and embrace the future God has planned for us.
Press on, and to know that the God that we serve is the same today, the same yesterday, and He will be the same forever.
Revival of Hope Global Outreach Ministries proudly present Man Cave Talks. Join us every Thursday night at 8 p.m. for Man Cave Talks by Revival of Hope Global Outreach Ministries. Hosted by the vibrant man Pastor Ronnie Joseph Hobson Sr. This program is a space for men to connect, chat, and strive towards becoming God's ideal man. Come, sit, talk, and enjoy meaningful conversations as we aim for personal growth and empowerment. Don't miss out on this transformative experience. Watch live broadcast FB Live at Revival of Hope Global Outreach and YouTube at Rogam. See you there.
In the journey of life, we often face trials and tribulations that test our faith and resilience. But through every challenge, there is a guiding light. Revival of Hope Global Outreach Ministries proudly presents My Mess Became My Message, 7 p.m. by Dr. Michelle Pert Ford. Dr. Michelle has transformed her life's challenges into a powerful message of hope and healing. Her mission is to create a safe space for women to find freedom, healing, and self-worth. Join Dr. Michelle on this transformative journey. Discover the power of faith, hope, and healing. Together, we can overcome any obstacle and embrace the future God has planned for us.
Press on, and to know that the God that we serve is the same today, the same yesterday, and He will be the same forever.
Hello. Pastor, we're not hearing anything you say, but I just want to take this.
Oh, I'm sorry. Well, I just welcome everybody from all over the world that's been listening here. Tell them how wonderful this week has been despite the rain, and how one of the most exciting things in my week is always coming to My Mess Became a Message with Dr. McHale. So take it away, Doc.
Hello, and welcome back to My Mess Became My Message, the space where resilient women share real stories of struggle, strength, and transformation. I am your host, Dr. McHale, and my co-host, Queenie. Since it is Speech Therapy Month, I have taken a detour to bring awareness to what we do as speech language pathologists while celebrating our profession. Speech language pathology is a multifaceted profession. We do not only work on R's and S's, we hold jobs in an array of settings, including the schools, medical, private practice, and also professors. Today, I'm excited to talk with a powerhouse in speech language pathology, Dr. Dawn Staley, not just in clinical work, but in academia. If you ever wondered what it's like to be a professor, mentor, and researcher while navigating the pressures of tenure in this field, this episode is for you. Welcome, welcome, Dr. Stanley. How are you?
I'm great. How are you doing today? This evening, rather.
I am doing well. I'm so excited to have you and just to hear your story and your journey.
Okay.
So tell us a little bit about yourself.
Okay. Well, I started the journey of academia about 6 years ago now. I'm entering my sixth or seventh year, and it has been very interesting. I've had my challenges in trying to navigate the position of tenured, but with God's grace and the support that I can get from the ones who are willing to support, I am navigating.
Well, that's a blessing. I mean, you can't when God is in it, it will work out. It will work out. So what inspired you to pursue speech language pathology, and how did that evolve into an academic career?
Okay. I would like to use the word purpose versus inspire. So I don't know that anything inspired me, but upon graduating from high school, I literally just grabbed a catalog and flipped through to see what my interest would be. And
Hmm.
I saw speech language pathology, but when I learned that I had to go through classes and then take a praxis just to be able to practice, I say, you know what, that's a little bit too much. So I ended up majoring in mass communication with a minor in marketing, and it just kept tugging at my heart. Speech language pathology. So I applied, was denied, applied, and denied. And so the third time was a charm. I was able to get into a graduate program, and here I am.
Oh wow. Your journey is similar to mine. Um, I didn't know anything about speech pathology because it's not a well-known field. So when I started, I went in to do pre-med, and my junior year, I think it was, I decided this is not for me. I do not see myself staying up 24 hours doing rotations. I love to sleep. So I realized it wasn't for me. I had no idea what I wanted to do at all. My guidance counselor, he asked me if I wanted to stay medical. I said, sure. He said, how about physical therapy? And I said, well, I can volunteer. So I went to volunteer that summer. And I came back and said that wasn't for me. He said, how about speech pathology? And I said, I want to be a speech teacher. And he said, I think this will be the job for you. So I took a few classes and loved it. Loved it. But fast forwarding,
Mhm.
I decided to go for my master's, even though, being a doctor, that was my passion. So I wanted to take a year off and then, try to do my MCAT. But my professor said, no, 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 continue. So I did. When I graduated and I got my first job, I was opening boxes. This letter fell out. It was a career assessment that I'd taken my freshman year, and my number one job was speech language pathology.
Wow.
So I found my passion.
Uh,
Yes.
Not just
Yeah.
That's
passion
great.
for both of you guys.
Yeah. So this is what I was meant to do. And that's why I enjoy every aspect of my job. So
Incredible.
yeah, can you describe your current academic role and what a typical day looks like for you?
Sure. I'm currently an assistant professor, and I would like to go a little bit broader than the typical day because some days I don't work, I don't teach, I don't have classes. So the
Hmm.
semester began by being assigned 9 hours. That's my caseload to teach. And some semesters you'll have the same classes that you taught previously. If so, great. Less class prep, right? But
Yes.
it doesn't always work that way or go that smoothly. So sometimes you have new class prep, which may take a little bit longer to do. I like to prep my class for the semester or at least up until midterm because I don't like to teach and prep at the same time. It gets to be a little
Hmm.
bit too much for me. So, and one of the challenges that I face is preparing the syllabi because you have to make sure that assignments align to ASHA standards and to make sure the activities and discussion questions are engaging and meaningful to the content at hand. Also, making sure that your calendar is aligned so that the students would know what's due when they're due, kind of like a navigation map for them. So in the classroom, I teach from a PowerPoint presentation, and the students have their copy within the system that we use, where they can access different materials. And I may teach one class a day, and sometimes I have 3 classes a day, and sometimes I have no classes a day. And in the midst of that, I may have college meetings, department meetings, and if I sit on any academic committees, I may be called in for a meeting. And of course, they're pre-scheduled, but some days I'm called into a meeting to pacify my citizenship for the university. And so that's a typical day of academia. And of course, I always still have to review and prepare for the information that I'm going to deliver. I don't call myself an expert just yet, because I know I've had some professors that show up with no notes and they can just teach. Well, I don't know that I've made it to that level just yet. So I have to review before I go in to present information to the students.
Okay, so what you just said seems like it takes a lot of organization.
Yes, I could be better organized, but I think the system that I have in place works for me.
Okay.
I see some of my other colleagues, she has a binder for everything. She has a divider for everything. And when you go to her for something, she can put her finger right on it. That's not me. I can get it to you, but give me a minute. But I could have a better organization system myself.
Okay. And that's one thing I noticed about speech pathologists, and those are the ones that I have done their fellowship year, their CF year, is that we tend to be very organized in our own way, because it takes a lot of organization to me to be a speech pathologist, because every day does not look the same at all. It does not look the same. So it's like prepare. And that's what keep us grounded, is organization and preparation. So for those unfamiliar, what does the tenure process looks like for SLPs in academia?
Well, this is a bit much to bite off. So not necessarily just for a speech language pathologist, but this would be the case for anyone in academia. And the way you navigate from assistant to associate to full professorship may look different per universities. Some may be just the documentation that you turn in and it is grading on whatever merit, and some have spelled out point systems. I've seen both. So you would submit what we call a dossier, which could be digital or in a 5-ring binder, because you're constantly collecting documentation and proof of tasks that you have participated in. And it's in 5 areas: collegiality, university citizenship, research and scholarship, professional service, and also teaching and advising. And so it is my duty or my task to make sure that I'm collecting artifacts and documents to insert in each one of those sections, because that's how I will be graded. It is ideal that they would want you to have at least 1 publication per year. I'm behind time. I don't have that, but I will be coming up on my 3rd year at this particular university, where I would have to submit my dossier. But I'm working on it, and I hope to have a submission by October 1.
Oh, okay. Well, that sounds like good stuff. So what is the research that you're working on? I'm always interested about research, what people are doing.
Yes.
How we're changing the field.
I'm trying. So currently my research agenda focuses on vocal health, and I'm looking at vocal symptoms in different populations. So my first investigation looked at vocal symptoms amongst speech language pathologists. Well, why am I looking at vocal symptoms amongst speech language pathologists? We should know this, right? Because we are the main profession that treats voice disorders. Well, from teaching the voice disorder class, I saw there was a gap in the literature as far as the populations that were looked at that have vocal symptoms. They look at teachers grade K through 12, clergy members, um, telemarketers, cheerleaders, but not speech language pathologists. And we utilize our voice daily in clinical practice. We have to have a variety range of pitch. We have vocal misuse. We have vocal abuse. And we need that for clarity and to perform the different strategies and techniques in trying to remediate or habilitate our clients. So that's where my notion came from, trying to fill the gap because our population was not represented there. And the second investigation that I just closed out at the end of this semester was looking at vocal symptoms amongst university professors. Well, I did see few studies on that, but not a lot. And so I did a pre-post design looking at the vocal symptoms and how the professors perceive their vocal quality may have changed from before the semester began to the end of the semester. So I'm waiting now to get a statistician so I can analyze that set of data.
That's always the fun part.
Yes.
But very interesting because we know I wouldn't have thought about us, and our voice, and we do that every single day. And
interesting enough, in one of the literature pieces that I reviewed, it asks if speech language pathologists practice what they preach, and the answer was no.
That's always the case with, I know there's a lot of that with like on the medical field, a lot of the nurses, a lot of the doctors that practice their work, they don't apply it to themselves. We tend to like forget.
Yeah,
absolutely.
You're so busy taking care of everyone else, you forget about yourself.
Yeah. Oh wow.
Yeah, that's interesting. I can't wait to see the results.
Great. I hope to get it out to you.
Yeah, definitely. So what were the biggest challenges you faced on your path to tenure while working toward it?
Well, let me go back a few steps. Actually coming up with a research agenda, trying to find spaces where the gaps were not filled. I did not want to be a researcher to ideally replicate what's already there, even though that's what research is. I wanted to fill in a gap. And so I found that gap. And so I'm working on that gap to fill in now. In the midst of me searching the literature to fill in gaps, I also found another gap that I could fill in, which is looking at, we operate off evidence-based practices, which have 3 components. And one of the components that was stated throughout the literature that was least researched was patient preferences. And so I wanted to do something with that also. But finding a research agenda is the first. Carving out time to be able to have a clear mind and a clear space to be able to write. Also, collecting the data. I had to create my surveys myself for the first time. And after now having some support, I see pieces of information that I left off of my survey that's pertinent, but we're going to try to navigate and submit for publication. Also, locking in with a statistician because I can't analyze my own data. So at that point, you're on somebody else's time, and I'm wanting to scoot along per se. And so I wish I knew more about analyzing data and using those statistical analyses and programs so I could do it myself. And so those are the things that I think are my challenges to navigating this position.
Oh, okay. And you said something about the finding. You said something about a research. What did you say about that? I think I missed it.
Oh, well, another research idea that I have, we operate as speech language pathologists off of evidence-based practices, and it's 3 core framework. And one of the pieces to that framework is patient preferences. And that is one of the areas that is least researched. For example, patient preferences as a speech language pathologist, we are supposed to include the parent when we are creating goals and the treatment plans. And I think it's factual to say that the parents don't really play a part in that, in creating the goals for their child. We just typically assess, write the goals ourselves, and present to mom, hey, this is what we're working on, versus it being a collaborative measure.
Oh wow. Because I tend to do that. Of course, I work with adults. So typically you ask, what is your goal? What are your goals? What do you want me to do for you? So yeah. So I didn't know
Well, in
that.
pediatrics, yeah. And I think in pediatrics, we should, because that's what we should do if we're operating off of our own framework. However, I don't think it's practiced well enough.
Yeah, absolutely. I mean, there's always more that we can do, and that is why we have researchers to bring that to the light. All right. And then hopefully
Yes,
one day you'll be able to present it to Asha.
one day. I'm working on it. I'm working there.
Okay, okay. You're working on big stuff. So yeah. I think the word needs to get out there. So now, how do
Soon.
you balance teaching, research, and service expectations while staying grounded?
Well, I listen to my body, and when it's time to stop, I stop. And mainly just rest and acknowledging that self-care is warranted.
And I think that's important because I know when I was working on my doctorate, I literally end up with high blood pressure.
Oh my
And that's
God.
because I was trying to balance home, working full time, and pretty much being in school full time. So towards the end, when I had to write, that took up a bulk of my time. I'm not a late night person, and I was up sometimes till 2 a.m. in the morning, and then have to get up probably 3, 4 hours later to go to work. And doing that over and over for several months, I end up with high blood pressure. So you're right, self care is very important, extremely important.
Yes, and we have to implement it.
Yes.
Especially if you want to, last long in your profession. Because if you do a lot of that at the beginning of your career, then you could easily burn out, and
Yes.
you start hating the profession that you loved at the beginning. So yeah,
Hmm.
really do have to prioritize yourself once in a while.
Yeah. So what does self care looks like for you?
My bedtime is 8:30. Doesn't matter what's going on. I try to meet that. And I actually have a reminder on my phone. And sometimes I have to chuckle to myself. I'm in bed most nights when it reminds me, oh, bedtime. So that's first and foremost. That's a must for me. That's very, very prominent for me. I like being alone. I like my alone time. I like my quietness, meditation. I have several devotionals that I read. I journal. Massages are a good way to relax and unwind.
Hmm.
And I like shopping. I'm a habitual shopper. I don't know that it's healthy in other areas, but mentally it's relieving for me.
Yes. Yes. I'm a shopper too. That's rehab for me.
Therapy.
Absolutely.
Yeah, it's therapy.
Therapeutic rehabilitation.
Yeah, extremely. Sometimes I spend a little bit too much, but in the moment, I felt like it was worth it because I feel better.
Absolutely.
Yes.
Absolutely.
Yeah.
It's a
So
very
see,
uplifting task to do.
yes. So see, guys, if you're listening out there, self-care is very important. Take time. Whatever makes you feel happy, whatever relieve that stress, go ahead and do it. And please don't forget to put some questions in the chat. Okay, so what kind of research or academic work you're most passionate about? Like if you could, I know you're working on a few different things, but what are you most passionate about?
The course content area that I like most is speech sound disorders, and I like teaching research. Those are the two areas that I'm most passionate about.
Okay, so can you elaborate on what speech sound disorders look like for
Yes, well,
those who are not familiar with us?
Yes, so speech sound disorders is the inability for individuals to execute um, or articulate sounds. Within the recent years, our governing body, ASHA, which is the American Speech Language Hearing Association, made speech sound disorders as an umbrella term for articulation, dysarthria, and it's some other ones, but I can't think of those right now. It's four others, but mainly articulation, which is the inability to execute motor speech sound. That is using your articulators, your teeth and your tongue, and also your breath to be able to produce certain sounds. And when that happens, there is an impairment there where the child is not understood. They have decreased intelligibility. So within that class, we learn anatomy and we learn assessing that type of disorder, and also some specific treatment approaches that can remediate the error sound.
Okay. So pretty much how to get those sounds out.
Do you have
Correct.
any ways for like nurses, for because I can't really relate much, so that we can help our patients with might have those kind of challenges. What do you think would be an advice for us who aren't speech language pathologists to be able to recognize these symptoms early on and be able to find the help that they need?
Okay. Well, by you being a nurse, I'm assuming you would be in some type of medical setting, and dysarthria is under the umbrella of speech sound disorders. And so someone may have had a stroke or may have gotten hit across the head, which may lead to TBI, which is a traumatic brain injury, and they may present with dysarthria, in other words, slurred speech. So as a nurse, what you could do is talk slowly with them, have patience, allow them to process and get out as best as they can their thought, and also explain to the patient, speak slowly, exaggerate, put focus and emphasis on the beginning of your sounds. And those few tips right there I could give to you may lead to the patient being intelligible, where you can have some communication between yourself and the patient.
Okay. A lot of trouble with communicating with patients like that, especially like post-stroke and post. Yeah.
And also, if they can't speak beyond that, the next best is to get a communication board, which is low tech. It's just a board or maybe a piece of paper where you have certain one word symbols or one word where they can communicate, where they can point, but you would have to speak on a lower level so that they can respond to what's on the board, so that you can understand what they're trying to communicate.
And collaboration between both of you.
Oh yeah, and sometimes even writing, if they're able to write, that's something that you can do as well.
Thank you.
Or just pointing to pictures. And Denise is saying, hi, Dr. Stanley.
Hello, Dr. Davis. Hi, Dr. Taylor.
And
That's my other speech sound disorder guru.
Oh, okay. Okay. Maybe we need to bring her on at some point as well.
Yeah, we'll get you on.
Yeah. So how have mentorship and collaboration shaped your academic journey?
I've had a lot of mentors along the way. When I decided that I was going to enter the master's program, I was able to shadow a speech language pathologist, and the clinical supervisors that I have had along the way have truly been a blessing to me. Their knowledge and their skill set have shaped me into the SOP that I am today. And from those mentorships, I have developed long-term friendships or long-term alliance where I can always call back and brainstorm, or if I don't have an immediate answer for something that's in front of me, I'm able to reach back and call and get answers and or guidance. And what that looked like in the classroom for me, especially with the undergraduate students. Some of them may be in the undergraduate program of speech language pathology and still a little iffy if they want to proceed with a master's degree or go to another field. So what I bring to the classroom is experiences, the good, the bad, and the ugly. And the feedback that I have received from my students with that is they can appreciate that, because most individuals glorify the field without talking about the undertones of the field. And also when they listen to SLP panels, it's all good stuff. They don't hear what could be going wrong or what could go wrong once you enter the field. So I think they have an appreciation of that.
Okay. So
And also just, I'm sorry.
go ahead.
Oh, and so just with my leadership skill, I lead in a way that I would like people to follow. I lead in a way that they can see a good way to lead. So if they do decide to pursue the master's degree and get out on their own, they'll have a good example from me, because I must say I am a good example, inside and out.
Yeah, absolutely. So the question for me, like, what are some examples of the negative in our field?
The burnout. I would have to say sometimes may not experiencing good information being delivered from teacher to student. And I can speak personally from myself. It was a lot of information that I did not receive as a graduate student, and I was lost, leaving out of the master's program working. And so I try to do my best to deliver information. And so some feedback that I get, oh, it's too much. Well, yes, our field is a lot. We're responsible for 9+ areas. And it seems like every 5 years they're adding something to us that we are responsible for. And I think the latest have been literacy. Okay. So it's a lot that you really don't get in the classroom, but you will be responsible for once you get on the job.
Yeah. And that's what I realized when I started working. Even though I did medical, it seems like all this book knowledge wasn't transferable. So it seemed like I was learning again on the job, but it was more practical.
Correct.
And I'm still learning. Like you said, it's ever evolving, ever changing, and there's always something new. That's why we continue to do continuing education, just to stay abreast of everything and to be the best clinician that we can be.
Absolutely.
Yeah. So now, as an SLP and academic, how do you advocate for underrepresented voices in our field?
Well, I would have to go back to teaching the undergraduate students. I make them aware of the stats, male, female, and I'll show the different racial statistics of the numbers of the individuals in the field. And I also encourage them to be aware, if this is what you want to do, you have to be dedicated and you have to be passionate about it, and that we need more representation. So once that's thrown out there, it's really up to the individual if they're wanting to take this route in order to make us more represented in this field. So also with advocacy, I've lobbied at the Capitol. And I've also created some pins, I think, a couple of years ago that I passed out to my colleagues.
Oh, I don't have it on today, but I wear it proudly.
That states that we're 3%, and I think it was like 3.4 when I first created those pins. So we might be at 3.5 or 6 now. I haven't checked, but I think we have creeped up. But it's just hard. And it's hard because a lot of individuals don't even know about our field. So I think we need to get back to recruitment, especially going back to high school day recruitment, and even at the middle school, because I think the middle school may offer that sometimes, but more prominently in the high school. So that was one of my to-dos, is to be active in recruitment at the high school level to create awareness of the field. So I think it starts there.
Yes. Yeah, and that's basically what I've done this month, is to create some awareness to our field. Because even when I walk into, so for example, I called a family member yesterday and I told them who I was and I'm going out to see their loved ones. And oh, she doesn't need speech. She's okay. She can talk. So then I had to always explain, like, okay, we work on more than speech. These are the things that I work on. Oh, yeah, yeah, yeah. Her memory, yes, she needs that. So yeah, so it's like that's what I'm trying to do this month, is bringing some more awareness to our profession and what we do. Because, like I said, when I started college, I knew absolutely nothing about speech pathology, and if it wasn't for my great counselor, he passed away right after I decided to, he diverted me to this field. But if it wasn't for him, I would have known absolutely nothing about speech pathology.
Absolutely.
Yeah.
I have conversations with Dr. Davis all the time. We have matriculated and through programs since graduate school. But in graduate school, I was lost. I would have to admit, a lot of things that was taught to me went over my head.
Mm-hmm.
And I have to admit, I know I became a better clinician after I became a professor, because
Mm.
I had to sit with the materials to make sure I was delivering it correctly. As a student, for me, it was read it to pass, not read it to
Yes.
internalize it, which was a wrong method. And I try to preach that to my student. I understand why you're reading to pass, but you're going to regret it if that's what you're doing. And so I just feel that I'm a better clinician by
Mm-hmm.
being a professor.
Well, sometimes you just have to practice, put what you learn into practice.
Yeah, that
And
too.
there are a few comments. They're so small, I can hardly read it. So Krista Taylor says, "Great point, Dr. Stanley." And Dr. Denise said something. I can't see what she says.
This is a collaboration field.
Okay, absolutely. And then River City Auditorium speech pathology. What is it to the layman to encourage them?
To become a speech language pathologist?
I'm
Well,
thinking it's probably, yeah.
okay. So, in layman's terms, I will explain to the individuals that sometimes you can hear people not being intelligible when they speak, especially kids. You may hear kids say spaghetti versus spaghetti, leaving off ending sounds, or just not being intelligible overall. That would warrant speech language pathology. If someone has had a stroke and has lost their ability to swallow, that would lead to them needing a speech language pathologist. As I mentioned earlier about traumatic brain injury, car wreck, fighting, gunshot wound, that could lead individuals with lack of awareness, the inability to have higher level of thinking, which is what we call executive functioning. They may not
Mhm.
be able to read a recipe and follow those steps. They may not they may have loss of memories, things of that sort. And even when we talk about our parents aging, where mild cognitive impairments and or dementia may be setting in because they are
Mhm.
having the disease is deteriorating the plates in the plaques within their brain, that would warrant speech language pathologists to come in and provide education to the caregiver and or some memory strategies or some memory aids for that individual so that they can remain safe and intact as much as possible with their family and the immediate individual that they come in contact with daily.
Yeah, absolutely. So we're multifaceted. I mean, why would you
Yes.
not want to be a speech pathologist? We're
And
never
even when
bored.
we talk about, I know I talked about the adults, but even when we talk about children in grade school, it's also the expressive part of it, language wise. They may have a thought, but may not be able to convey it in an order. Like here in America, we are subject, verb, object. That's our rule. And so they may not talk in that form, which makes them not be able to understood, and people have to ask them, what are you talking about? What did you say? Did you mean this? And so it's also written and oral communication, and it's also literacy. We help with literacy, we help with reading, which could look like segmenting and decoding words so that they can blend them together to be able to read fluently through a passage. So like she said, we're multifaceted, and it's a lot to learn and a lot to do.
Yes, yes. And like one every day does not look the same. And then in children also the receptive aspect of it. Can you explain that for us?
Ask me again, please.
In children, the receptive part and also the executive function, what does that look like in children?
Well, with receptive language is what they can or cannot understand. So if they have receptive language impairment, they aren't able to understand what you're asking them to do. So you may have to repeat the information. And so what therapy may look like, following two-step commands, 1 2-step command. I know in some children you may ask them, go get your shoe and your sock, and they may come back with the shoe and not the sock. And executive functioning in children, I don't know that I've ever treated executive functioning within children, but I would imagine it's the same concepts in adult with the memory and being able to recall, being able to sequence. And so tasks like that.
And Denise said stuttering in the voice. So that's yeah. So we work on a large array of things.
Yeah.
Yeah. All right. So what changes would you like to see in academic environments, particularly for women and people of color in speech language pathology?
Okay, I would like to see more people of color, student-wise, being represented in HBCU master's programs. I would like more people of color to tap into academia. I think that people of color can, associate better and maybe also learn better if they saw a greater representation.
Yeah.
I would also like for people of color to know and understand that they do have a place and they do belong here in this field, despite what the statistics tell us. We do have a place. We belong here. I would like to see more people of color, especially in the master's programs, to participate in the thesis option versus just the graduation exit exam. I would like to see more people of color participating in research and presenting and just having more of a presence at conferences. And lastly, I'm thinking just from teaching, I would like people of color, the students, to take accountability for their learning, take control over it, and take their feedback from their professors and apply it and navigate it that way versus it, you didn't do it, you didn't do it, you didn't do it. Well, teaching and learning is a two-way street. It's an alliance. And so, and yes, and I find that students today lack that accountability with adjusting to different teaching styles and also finding themselves ways to study and navigate their own lessons that they have to learn themselves.
And I think also because these kids, they're spoon fed. They think they're what's the word I'm looking for? That they're not supposed to earn anything. It's supposed to be given to them. And that comes from parenting. It's important to teach our kids from the time that they're young how to earn, how to be grateful, how to show gratitude, how to become independent. Because that's something I realized when my daughter was about 12, that she thinks that everything was supposed to be given to her just because she asked for it. It was supposed to be granted. So then we had to flip the script and say, if you do this, then this is what you get, because we're preparing you for the real world. The real world doesn't hand stuff over. You have to earn it. And another thing that I want to add is that I take every single Black person at my church that is going to college. You should check out the speech pathology program. And when I lived in Indiana, I used to take the young girls to shadow me. And I think 2 of them end up being a speech pathologist because they love it so much. So I think it's important that they're not just us telling them, but having them shadow us to see exactly what we do. Because it's not like when I went to Alabama A&M, took my daughter there, and the president was trying to encourage her to do speech pathology because he said, this is a HBCU and we only have 1 Black student in the program. So it's not a sexy field. It's not like nursing or anything. It's not well known. But hey, it's very lucrative. It's very lucrative.
Candy.
Yes, exactly. Because I mean, it's so many different areas you could branch out in. You could even have your own private practice.
Yeah.
It's so much you could do in speech pathology. So I take the time out to talk about us. I mean, I know we burn out and I know things like that happen, and that's any job, but I still think that we are in control of our day. We set our schedule. If you want to have a heavy day, you can. If you want to have a light day, you can. So, and then you have, if you work in the school, you have the summers off to spend more time with your children. If I have a doctor's appointment coming up, I schedule around it so I could be there for my kids. So yeah, it's definitely a good field. And I think Christy, she said, I can't read it.
Recruiting, it says recruiting.
Yeah, Christy Taylor, she said, I'm always recruiting.
Oh, yes, that's important, especially people that look like me and you. I'm always recruiting.
Yeah. And just to add, when you say private practice, I run and own a private practice here in Baton Rouge, Louisiana. And so I'm juggling that in the midst of having a full-time job within academia. So I am mindful to keep my private practice to a limit, but it makes me feel good that I can reach back out and help the individuals within my immediate community. So I'm also juggling that.
So how do you prioritize time? Because you're working all day and then a private practice and still be in bed at 8:30. How does that work?
Absolutely. I don't miss 8:30. However, so I work in academia Monday through Friday, and on Saturdays and Sundays are the 2 days that I treat my clients during the semester. But during the summer, I'm open. So I'm working any of the 7 days of the week during the summertime at my private practice.
Okay. Well, seems like you're working 7 days a week, but you're getting your rest. So I guess you can juggle that as well. And someone says, what about Latino, Filipino, other minorities? Our audience includes more than Black. Oh, yeah, definitely. We want minorities. We do have a variety. We have Filipinos that are speech pathologists. We have Latinos that are speech pathologists, and we also have Indians that are speech pathologists. It's not just us.
Right.
So we have other minorities.
People of color include those other ethnicities that Dr. Michelle just spoke.
Exactly. Were you saying something, Queenie?
Oh no, I was just gonna follow through that. How does your work in academia impact the future of speech language pathology as a profession?
Yes, so it is my hope that the information that I am delivering to my students, I am further training and preparing the next generation to be better than me. Okay. So ensuring that they are equipped with the current knowledge, professionalism, ethical standards, making sure that they know to always be rendering evidence-based practices, that they are not to just go in and treat by the fly of their seats. And sometimes that happens, but it's still a method to the madness. And also incorporating cultural competence. That is important nowadays because we do treat different races and different ethnicities. And so what one may believe, another belief may not be there. And just to make sure that the stimuli, the pictures, and the activities that you are presenting to the client is not being offensive, or you're not crossing any lines with those clients. So making sure that that's instilled in the students today. And also, I hope that I am influenced by shaping the students' professional values and also their dedication by ultimately contributing to a more dynamic way of contributing to this dynamic field that is forever evolving. So that is the hopes of my legacy that I hope to leave.
Okay, so there's a comment that said, so it's the people of color that need to be involved. In another episode, it was said that dialect is not a defect. Having
Yes.
people not from the dominant culture would assist in students not being mislabeled. And that's so true. Because it's important, if you can relate to a student, then it makes it easier to determine if it's a dialect, a speech difference, or a speech impediment. Absolutely.
And that's where the cultural competence also come into play, and also being able to have alternative assessments to be able to hone in and pinpoint what the commenter just stated.
Mm-hmm. And then I know those assessments are limited for us because they weren't norm for
Correct.
minorities. So that's probably a gap that you could research on at some point.
I'm gonna leave that to another researcher because that's not my area.
Okay, so what advice would you give to students or clinicians considering a transition into academia?
Don't be scared. Try it, even if it's adjunct or being a clinical supervisor. It's warranted. You are needed. And I will also just encourage to even think about pursuing getting your PhD or your EDD or even a clinical doctorate. Clinical doctorates are fine. It's just the preference of the individual. Some universities may not hire clinical doctorates because of the another one of our governing bodies have stipulations around what percentage of the faculty need to be PhD versus masters and so on like that. But there are opportunities out there and we are needed. Some departments are running a skeleton show, okay? And so it's encouraged that we get some more individuals in academia.
Yeah, and he said, don't be scared or don't be scared. Encouraged to get doctorate. So yes, we're encouraging you to get your doctorate so that you can have a voice.
Mhm.
And can you describe for the audience the difference between a clinical doctorate versus a PhD?
You want me to explain? Sure. So a clinical doctorate go through the same technicalities that a PhD or EDD individual go through. We have to do research. We have to research human subjects. We have to go through IRB. So if our research study is not um, up to par per IRB and research standards, we cannot proceed. The only difference, I would say, from my learning the difference in it myself, is that clinical doctorates take a shorter time to matriculate through the program versus a PhD or EDD program.
Mhm.
But the information is still the same. We have some of the same mechanisms that we have to navigate and matriculate, just like PhD students and or EDD students.
Okay, so see, it's the same. It's just a preference when you go for a job. And
Correct.
Denise says there are ways to evaluate a person's communication profile without the use of formal assessments.
SOP are needed.
So
Yes.
SOP is speech language pathology. It's just abbreviated, are needed, especially those not from the dominant culture, and that is so true. And that's something that we are trying to work on. I don't know if that will close a gap at any point because we're so far behind. But the more we get the word out there, the more people know about us, then I'm sure that they will start looking into, even if it's just researching it and taking a few classes, then hopefully that will take us from, even if it's just 10% of us, I think that's a huge number, and that will bridge the gap when we, in assessments, especially in the school settings.
Mm-hmm. You know what we have this called Filipino potluck, and that's why like when you think of Filipinos, you think of nurses, because everyone whenever we would have potluck, it would share like that this is a good profession, and then that's why like a lot of us Filipinos lean in towards like healthcare with nursing or
Mhm.
doctor. So that's a good way like we in incorporating it with like community gatherings and letting the word out. That's a good way to do it to help spread awareness about SLPs.
That's true, and a lot of Filipinos are physical therapists as well.
Yeah.
It's a lot of physical therapists and a lot of nurses, and that makes sense in every setting. Just try to
Eating.
recruit. Try to recruit. Do you have any final word, Dr. Stanley, before we close?
Sure, I'll share some. Speech language pathology is a rewarding field. We have different settings that we can work in to rehabilitate individuals who may have various impairments. I must say that the burnout could come fast, but it's up to us to find a balance to it and also know when it's time to maybe shift to another setting to make sure that we're still practicing to the best of our abilities and also to our skill set. And academia is a nice setting to be in. It's very rewarding. It provides a lot of flexibility, and I have learned to love it. I like seeing the students grow. I like seeing them when they come in, they feel defeated, and then bam, 2 years later, we're graduating. And I tell them, see, I told you the time flies by quickly, but you don't see it and they don't see it while they were in the midst of it. I didn't see it while I was matriculating through the doctorate program. It was like, oh, another semester. But time does fly, especially when you're having fun.
Exactly. Even if you're not having fun, it's still fine. Like I always tell the young people, if you sit out for a year and do absolutely nothing, that year will fly by regardless. It's not going to wait on you. So that's going to be a year wasted. So why wait when you could do it today? Why wait for tomorrow when you could do it today? So yes.
And
So I
there was
want
a
to.
motto. I'm sorry. Go ahead.
No, go ahead.
There was a motto that I created for myself as a little motivation to get me through the doctorate program. And it is just start the race, it'll finish itself. And I find that to be so very true. A lot of people have issues of procrastination and just not being able to get started. But I promise you, if you get started in whatever it is that you want to do, it's going to finish itself.
Absolutely. You just have to step in the water. That's it. So
Mm-hmm.
yes, so I
Absolutely.
want to thank you for sharing your journey with us, the wins,
Thank you for
the
having me.
struggles, and the wisdom you've gained along the way. It's voices like yours that push the profession forward and help others see what's possible. To our listeners, if this conversation sparked something in you or gave you a new perspective, don't keep it to yourself. Share it, rate the show, and stay connected. Until next time, keep leading with your brain and your heart. Please join us next week as we shift gears back to relationships with the topic breaking free, healing from traumatic relationships and reclaiming your power. Until next time.